Hello everyone, my name is Nathan Green, and today I'm going to do a presentation on attention deficit hyperactivity disorder, as well as behavior therapies. Let's begin. What is attention deficit hyperactivity disorder? Attention deficit hyperactivity disorder, otherwise known as ADHD, is a neurodevelopmental disorder that causes a person to have trouble maintaining their attention during any task, as well as to be unable to participate in a quiet manner during any form of activity for a prolonged period of time. To be able to be diagnosed by a professional, symptoms have to be detected prior to reaching 12 years of age and must occur in a multitude of settings. Now, this doesn't mean that it can only be an isolated incident. This means that these symptoms occur everywhere, like in every situation. ADHD is one of the most common psychological disorders that affects children within the United States. The group most likely to have ADHD are those who were assigned a male at birth. Worldwide, ADHD occurs in around 5% of children, and that's like in all cultures, so it may seem small, but that is it's relatively small, I guess, but still a good amount of people. Let's move on. Next, we have the causes. There are a myriad of potential causes and risk factors associated with ADHD. These include being prematurely born, being born with a low birth weight, exposure to alcohol and smoking during pregnancy, exposure to lead during childhood. Now, this aspect is worsened by outside factors such as poverty, so keep that in mind. Continuing forward, we have the use of pesticides in combination with genetic risks, exposure to harmful events at a young age, such as being physically, sexually, or verbally abused, and genetic differences, which may make a person more prone to developing ADHD. Recently, studies have found that sensory and neurological problems are strong predictors of ADHD symptoms in 17-year-old individuals. Next, we got common symptoms of ADHD. ADHD is comprised of three major symptoms: inattention, hyperactivity, and impulsivity. Inattention is when an individual consistently abandons anything they are doing and is unable to remain engaged with any activity, and has trouble with staying focused in any capacity. Hyperactivity is when an individual is extremely active in an over-the-top manner, especially during times when this behavior is uncalled for. So this could be like during class, they're acting out in class and uncontrollably. So keep that in mind. It's not just like normal children not being able to kind of sit still. This is a very different, very uncontrollable type of behavior. Signs of hyperactivity include uncontrolled fidgeting and restlessness. Finally, impulsivity is when an individual engages in actions without planning or thinking ahead. This is usually done in situations where someone, such as a child, is unable to stop themselves from doing something that gives them a sense of gratification. Now, a recent study has found that adolescents with ADHD are more likely to engage in more impulsive and risky decision making than adolescents who do not have ADHD. The study also found that this behavior is tied to an aversion to delaying gratification. So a lot of this like uncontrollable behavior and inability to kind of control one's actions, a lot of it ties down to the inability to delay gratification. Like they feel like they need to do this, and it's uncontrollable. It's not like they're choosing to do this. It's just kind of how their brain is kind of wired. It's that they feel this need to get that instant sense of gratification instead of being able to delay it until further time. Moving forward, we have the negative effects associated with ADHD. ADHD has many negative effects associated with it. Among these are the fact that it can negatively affect children's ability to perform well in school, the fact that it can prevent individuals from developing socially, the fact that it negatively affects a person's ability to maintain good relationships with their peers, the fact that it increases a person's likelihood of being bullied in school, the fact that it increases the chances that a person may engage in illicit delinquent activities, the fact that it predicts that young adults will have lower quality relationships, the fact that the fact that it is associated with an increase in relationship issues, increased chances of imprisonment, and a poor socioeconomic status, and the fact that it increases the likelihood of developing depression as well as one's chances of sustaining injury. Now, that last part, the increasing one's chances of sustaining an injury, that's in terms of like, impulsive, unplanned actions, kind of just doing whatever comes to mind, that could lead to injury. Now, our final slide here is the treatment types associated with ADHD. The first type is stimulants, which includes drugs such as Ritalin and Adderall. These drugs work to increase dopamine flow within the brains of children suffering from ADHD. This increase in dopamine levels makes it so that these children are receiving the sense of pleasure that they would normally get from acting out, and thus allows them to be able to maintain more control over their impulses. Stimulants are typically the first treatment option used, as they are usually the most effective in treating ADHD symptoms. Following this is the use of non-medical interventions. These include physical exercise, sports training, and meditation. These activities give children with ADHD an outlet for focused activity, which allows them to build their engagement and focus skills. These interventions often work best when combined with the use of medication, which is why these, stimulants and non-medical interventions, these two things usually happen simultaneously. Now, finally, there's psychotherapy. This treatment, which is typically like your traditional talk therapy with a therapist, is the go-to route for treating young children, as well as those who do not react to medication. Interestingly, psychotherapy is also an effective way to treat ADHD symptoms in adults, as well as parents of children with ADHD, as it can help them de-stress and learn the best ways to deal with any difficulties that may come up.